Hello everyone. Here we are presenting our business plan about the urgent care center which is focusing on women's health, prepared by Mohit Malik, Dilip Makwana and Mohammad Ahmed.
Welcome, everybody. Today I would like to talk to you guys on why our group has focused on opening a clinic, and particularly a women's health clinic that operates 24 hours. There are a few basic services that we hope to provide. One, which relates to general health, routine checkups, just making sure everything is fine. Second would be related to any emergency needs that may arise. And third, we believe, which might be the most profitable, is any pregnancy-related care that a woman may need. Problems that we're hoping to address include building a better relationship between patient and clinician. Working in the health field, I've noticed doctors are in a time constraint with very set resources, and often they're pulled to different patients depending on their severity. So we believe in a small clinic that focuses on three basic needs. We can actually have more time to provide a patient, address their medical needs, the emotional needs, whatever needs that they have. The patient and the clinician can actually foster a relationship that ultimately leads to their health benefiting. Also, we believe that having a around-the-clock open door will allow us to address any emergency needs that may arise, either 12 at night, during the day, whenever. Also, we've noticed that Stony Brook is currently growing. Their children's hospital is about to open up a whole new building. So we believe that we can definitely tap into some of the complementary services that Stony Brook Hospital may need. This slide will talk about the human resource aspect of our clinic and the staff that we hope to get on board. So there's two categories that we broke the staff under: office operations and clinical operations. Clinical operations will be when the licensed practitioners will actually deal with the patients directly, and the office operations will be everything but that, meaning dealing with the insurance companies, the pharmacies, the billing, all the day-to-day operations, whereas the clinical operations deals with strictly the patients. Of course, there'll be some overlap, but in general, we hope to divide the boundaries in this way. So the office manager will ensure everything goes well during the day. The front desk will be the ones that greet the patient and follow up with any of the billing stuff. The medical assistant can be a floating position where they could help the front, but they're not really licensed practitioners, that they could still assist the clinical side of things. Of course, the doctor, surgeon, and physician assistant will be the ones that provide the care, prescribe the medications, and deal directly with the patient.
Let's talk about opportunity available in the market. With rising waiting time for both primary and emergency care providers, urgent care centers have become an increasingly viable alternative for patients. During the next 5 years, the industry is expected to continue expanding. One of the main factors growing for the industry is increasing yet unmet demand for primary care providers that ultimately pushes more patients to this industry's operators. Additionally, the Patient Protection and Affordable Care Act will expand insurance coverage to millions of people by 2020, and increasing healthcare awareness in the current years are another driving force to growth of this industry. And high barriers to entry into this urgent care segment of healthcare industry due to there are multiple regulatory requirements and controls, and very high initial sunk cost for this kind of business. Another driving force for this business is convenience. Convenience is the key. More convenient options to get basic medical care, and retailers like CVS are filling up the gap with walk in clinics and other services that forcing traditional healthcare providers from small doctor's office to big hospitals to react on this. Providing convenient care service is no longer a secondary consideration filled by moonlighting primary care physicians. It is a distinct growth service line likely to capture more of the projected at most $5.4 trillion to be spent on healthcare by 2024, means 2024. Everyone might have observed or experienced that any primary care doctor or a physician or a specialist, if you need uh, an appointment, the waiting time is too long. Sometimes week, sometimes couple of days, couple of weeks, and for some kind of specialty doctors, sometimes months. So that is the big problem with our healthcare system and industry. Uh, Due to short of resources like expert doctors or specialty surgeons and fewer uh, availability of hospitals or clinic cares, that is accumulating, and average wait time is increasing. One of the survey I have captured on this presentation, it shows different wait time, average wait time for an appointment with the doctor in the United States, and you can see the New York has a 10 days of average appointment waiting time, and especially for specialty doctors like gynecologist and kind of stuff, right? There is a increasing waiting time for an appointment. Women's health. Women's health need to be front and center. It often isn't, but it need to be. Women's health have a unique health issues. Women are taking care of their children, family, office, husband, you name it. The least preference she gave is for herself, and that is the reason she need to be addressed, and her problems need to be addressed, and uh, needs to be taken care. There are many dangerous conditions that woman doesn't realize they are living with, like HPV, endometriosis, polycystic ovarian syndrome, and you name it. In a recent year, there is a Zika virus and breast cancer. Those are the growing diseases, and without treatment of this kind of illnesses, or without diagnosis at early stage, it can have a serious consequences. 80% of females carries of some or other infections. Early detection is necessary, and if any symptoms is observed, it need to be addressed immediately. And because of very fewer uh, care centers and expert doctors, the waiting time for the appointment is increasing and increasing. Women's health awareness. Another important factor for opportunity of this kind of business is increasing women's health awareness. Nowadays, women are better aware about her health. They are taking uh, care of herself as in nutritional foods. They they are taking more exercises. They are more aware about yogas and different stuff which is related to health and preventive measures. And women's health preventive services are more often providing the awareness to the society. Women are continuously during the pregnancy or different times uh, needs to be taken care of prenatals, vitamins, and all different things. So those are the all different steps increasing the awareness of her health. And Patient Protection Affordable Care Act is expanding their coverage to specifically for women and pregnant women. So those are the another reasons to have a good opportunity of this business. Another opportunity is regulatory hurdle. This business needs a lot of regulatory requirements, and to fulfill those, it has a barrier to entry. The upfront high cost for this business, because this urgent care center needs expert doctors, need a lot of technology and modern instruments for the testing, and a lot of cost is involved. So it is overall generating a barrier to entry for this business. So there is a lot more chance to get a success in this business. Long Island is not much competitive for women's urgent care, as we have seen in a previous slide. Only few competitors. There are a few names. Cure Urgent Care, CTMD are the primary competitor for women's urgent care center on the Long Island. And we can compete those few of the names by providing the convenient services, better services, and attractive services like walks-in 24 by 7 services, online services for the appointment, refill prescription, cancellation of an appointment, and over the phone doctor's advice, integrated electronic medical records, so patient don't need to worry about every time taking their uh, taking their records and remembering and keeping the papers and files. It can be accessible anytime online. Reminder calls for the appointments and prescription refills, and those kind of attractive services we can provide and make a better competition with existing player in the market.
This slide will discuss the operations aspect and how a typical visit to the office may run. We broke it down into about 5 steps. So, just like most offices, patients will come in through the doors, be greeted by a medical secretary at the front desk. Here, they'll exchange um, insurance information and past medical history, where the medical secretary can then update any of the electronic medical records. They will then be called into the exam room by a physician assistant for our initial workup, or if things get a little too complicated and physician assistant believes that a physician should take over the case, a physician can then do so. And if it's anything related to surgery, the surgeon can then take over the case, order the labs, perform the biopsies, and schedule the surgeries. So one side note about the surgeries, we don't believe our clinic can do the surgeries in-house. What they'll have to do is link up with the affiliated hospital, which is a common practice among physicians and doctors because they are affiliated with hospitals. So in this example, what we'll have is our surgeon performing the surgeries, let's say at Stony Brook Hospital. But what they'll do is everything needed for that surgery will be done prior to at the clinic here. Once the clinicians are done working up the patient, they prescribe medication and a treatment plan and update any of the medical chronicle records. The patient will then go back to the front desk. They will then make a future appointment, deal with any of the insurance related paperwork, and hopefully come back to the office. So this slide will talk about our financial plan. We believe that the cost to start the clinic will be roughly around $200,000. Our goal is to attract investors. If not, we could borrow the remaining need. The $200,000 will go to monthly costs that include malpractice insurance, renting space, equipment that we'll need in order to be functional, and any administrative costs that are required when opening up a new business. One note about malpractice, we believe that there's a huge risk with the cost here because for OBGYN, usually the malpractice rates are the highest, and depending on the physician's record, this can be a very variable cost right there.
Healthcare facility 24/7 OBGYN will be a state-of-the-art facility focusing first on the patient's safety and fulfillment, preparing from the start of a positive decision, leveraging state-of-the-art machinery to boost procedures and results and finally fulfilling widespread infection control protections. Targeting efficient facility that includes a patient bed that adjusts automatically to give comfort to our patients. The new kind of IT and research development will implement the centralized medical records to create a system that collects all the currently available information which is relevant to the patient database based on the entity of the healthcare professional. The faculty will also assess to create the low cost realistic substitute to centralized medical records which could be developed fairly quickly. We then have plans to design the electronic medical research engine system, which are able to retrieve all the obtainable data about a patient who has been hospitalized in diversified hospitals in the country, and this information is readily available to the health professionals upon their request. Also, the software will keep the compatible record of the patient, for example, their medication, follow up appointments, reminders, text message updates for the future appointments, etc. The medical facility would also provide the private ward for patients who need privacy. There will be a refreshment center which will also be serve the healthy food to serve the patients as well as the visitors. Apart from this, this will be and we will ensure the investors that they are investing in the business idea will be successfully implementing the business venture will be a successful. 5-year plan is to promote 24/7 365 OBGYN to expand its clientage in the tri-state area. The company will constantly work for release of a new version of the MRSE software. The clinic's mission is by providing best Medicare for women of all ages like general health, pregnancy related care, breast cancer, ovarian cancer, etc. The clinic will serve the patients who have the appointment scheduled and also the walk-in patients are welcome. The new patients' data will be entered into the EMR system. We expect majority of our patients to come in the routine checkups to be performed by the physicians. The company have team of highly experienced OBGYN physicians who will start the initial treatment. If the situation is complicated, then the PA can turn the physicians to continue with the exam. The physicians can consult the surgeon if required. The surgical intervention will be scheduled in the Stony Brook Hospital, which will be affiliated with our center because they are affiliated there. Aftercare is delivered and the patient ends their appointment. The secretary will schedule a future appointment and continue the billing process to the insurance and the patient of their remaining balance. The company will carry out need-basis marketing activities during the facility launch in the form of first consultation free or new patient discounts. The company will give a reward card offering discounts to its returning customers and patients. The company has developed its marketing objective towards expanding the definition of the health for all the women patients. 24/7 OBGYN wants to target all ages of women with all types of OBGYN problems and issues. Our goals are to increase OBGYN awareness among existing and non-existing patients to increase the ROI ratio of the company by 5% in the next 6 months. 24/7 OBGYN has planned to promote different ways, which include posters, campaign, flyers, advertisements. We will also be targeting through direct marketing and SMS messages. We will publish information about our facility on Facebook, Twitter, LinkedIn, and other social media as they are very popular ways to reach the majority of the people.
Hi guys, as we discuss in our presentation, we think this is a very viable business plan, and we hope you enjoyed our presentation. Thank you and have a good luck.